Hello friends, myself Dr. Ketan Shah from Ahmedabad, Gujarat. In this video, I am talking about GERD, Gastroesophageal Reflux Disease. Means you can say that symptoms like heartburn or acidity. So in this video, I talk about the causative factor of GERD, its symptoms and homeopathic management. In this video, I shared 5 cases in detail and I showed how I treat these cases of GERD. This is the recording version of one of my webinar which I presented for an international student. So this video in English, and if you want to see same video in Hindi language, you can visit my another uh, video which in Hindi. So let's start. Thank you very much. Good morning to good evening, because various peoples from various part of the country of the world, they are joined here. So today's my topic is gastroesophageal reflux disease. In short, we can say it GERD. Why I select this topic? Because in my practice, most of the you can say patients of either respiratory system or GIT system. Many people are suffering from allergic problem. So because of allergy, there are cough, cold, sneezing, and many people are suffering from GIT problem, diarrhea, dysentery, many problem, GRD, acidity, you can say. So lots of problem related to gastric problem. So I will talk about GERD, and these are the news, and this is the research that people who are taking this antacid tablet for a long time can create a cancer. And this is the eye-opening research for the patient who are regularly taking allopathic medicine, particularly for acidity. And because of this research, they are frightened and turns to the alternative system for their permanent cure. What's happening in GERD? So we all know that there are the secretions, bile juices in stomach, and when this juice come upward, back pressure in the esophagus, that causes erosion or problem in the esophagus. So this stomach acid repeatedly contact with esophagus can create a problem, and that's the GERD. Small understanding about epiglottis. We know that whatever we food eat, that should be go in esophagus. But at that time, because of epiglottis, that prevent the food not go in the windpipe. Otherwise, if this food reach to the lungs, it can create some problem like pneumonia or anything. So because of this epiglottis, our food directly goes to the esophagus. And because uvula is a part which prevent liquid passing from upward. It's not allowed to this liquid to pass in the nasal cavity. So this is the very important for us, that upper esophageal splinter. This splinter, because what's the action or work of this upper esophageal splinter? That when usually it's closed, but when there is the signal that food or liquid are coming, it's become relaxed and allowed to food in the esophagus. And Once this food pass, it's become closed. So you can see in this figure also, there is the upper esophageal splinter, and this is the work. Now, this is the lower esophageal splinter. This is the main portion. This is the main problem for the GERD. So this is the at the end of esophagus and stomach. At the junction of esophagus and stomach, there is a splinter. It's called lower esophageal splinter. When foods come, it's become relaxed and allow food to pass in the stomach. And once this food passed already, then it's shut down. So because of it's shut down, the gastric juices, any substance from stomach not come back or upper side in the esophagus. So this is the function of lower esophageal sphincter. Now, when this sphincter, lower esophageal sphincter become loose or damaged, it's create problem. So this is the main problem of GERD when this lower esophageal sphincter become weak or damaged. So the food come upwards in the esophagus and it create problem not only esophagus, sometimes it reach to the pharynx or up to the throat and it causes many problem of the GERD or you can say heartburn, acidity like problem. Why this LES, lower esophageal sphincter, become weak or damaged? So first and most common cause is overeating. When people eat more than his capacity, the stomach become expand or you can say swell and causes inside pressure. And because of frequent pressure on this LES, it become damaged or weak. Obesity is another reason for LES. Even regular habituated people like smoking or alcohol also damage their LES. And one more factor that pregnancy, that's the 40 to 85% women suffering from or they damage their LES during the pregnancy. So these are the reason. More two reasons I want to share that fatty food. If patient in that diet take more fatty food, oily things, that also can damage this lower esophageal sphincter and many medications like asthma medicines or antidepressant, antihistamine, sedative. Patients taking this type of medicine for quite a long period, that also can damage the LES. So these are the problem why this LES damage or become weak, and because of LES develop, it's become weak or damaged. It's allowed the stomach's juices in the esophagus, and that causes GERD. One more reason for GERD, that hiatus hernia. Stomach part comes push upward in the chest cavity, and this also causes GERD. So hiatus hernia is another reason for GERD. So if this reflex occasionally in, then no problem. But it's this occur very persistently, very for long time, prolonged time. This juices come and contact with esophagus, then it create problem, and that damage to the LES. So we should take care of to prevent this damage of the lower part of the esophagus. What are the common symptoms of GERD? Very easy, that it's heartburn. Patients complain that retrosternal burning and discomfort, regurgitation, effortless return of the gastric content into pharynx without any efforts. Automatically, when patient lie down or after eating, some substance from the stomach, it's reached to the pharynx and water brush. There is a soreness, sore feeling in the mouth and belching, passes of the gas. These are the common symptoms. Except this, non-allergic asthma. Because of this gas, there is the asthma-like symptoms. Even this acid reach to the throat and it affects the pharynx and voice box. That causes hoarseness, pharyngitis. Because of this gas, there is a chest pain. And if this acid comes directly contact with teeth, it causes the dental erosion. Because of this acid, patient have a sensation that there is some lumps in the throat, and because of that, cough is there. So these are the symptoms. What advice should give to the patient? So we have to tell patient that you have to eat small meal at a time, but you can eat frequently. 4 or 5 times a day, you can take your meal, not a large amount at a time. So avoid large amount of food at a time. And after eating, don't lie down. You can keep your body posture in upright position. And don't sleep immediately after dinner, but it should be 2 to 3 hour gap after the dinner, which allow to digest your food. And if you are habituated of smoking or alcohol, then you should stop this. Otherwise, this also one of the factor which damage your lower esophageal splinter. So how can we treat GERD? So not only with medication, of course, medication will help, but this is lifestyle problem. So you have to improve your lifestyle. So with the lifestyle changes and with our medication, we can treat GERD very easily. If we left untreated, then it can create a problem and we have to go for a surgery. How can we make diagnosis of GERD? So very easy to diagnose GERD because out of the symptoms from the patient history, we can diagnose this very easily and we can advise endoscopy. Through endoscopy, we can study the esophagus part and stomach part. So we can know if there is the H. pylori bacteria is there, if there is a ulcer, or if there is a problem with this lower esophageal sphincter, we can know with the help of endoscopy. So endoscopy, we can say, is very good diagnostic criteria for GERD. Now we start our homeopathic part where we can see the patient's complaint in a rubric. So most of the repertory, when we see in the stomach chapter, so stomach chapter acidity, in stomach sore irritation, burning irritation, water rush, heartburn, mouth water rush. Even we have a rubric in throat also, because throat is also affected with this acid. So throat pain, acidity from. In stomach also, even children and infant also affected with this type of acid secretion. So stomach acidity, children in and infant. This type of rubric also available in synthesis repertory. Even many times, because of this bile secretion, there is the headache or migraine. So you can say, search head pain accompanied by acidity. Soreness. In Phatak repertory, there is a soreness, acidity. Hyperacidity in boric, and acidity, sore stomach in morning motion. So we have in boric repertory direct rubric that hyperacidity. Now, first we discuss about sign and symptoms and diagnostic part of the GERD. Then we discuss about where to search, how to find this patient complaint in our repertory. That we also discuss. Now we can come to the therapeutics part. Before that, I will present 5 cases, different 5 cases where this problem of GERD and how and what repetition I prescribe medicine, that will I show you. So this is the first case of 65 years old female. She approached me for her heartburn, frequent irritation, and gas-related issue, distension of abdomen and gas-related issue quite since long time. When I took a detailed history, she mentioned that intense anxiety. This patient is very anxious related to work and experience heightened anxiety when anticipating guests. So she gave me an example when some guests are coming after 2 or 3 days. So my mind start thinking about that. How can I welcome the patient, guest? What I can prepare for them? How I give all that facility to my guest? So thinking process start. Even it's very normal. No need of any thinking about this type of uh, activity. But her mind started thinking it's normal guest, 1 or 2 guests, either coming for normal lunch or dinner. Then also she become anxious, and because of this anxiety, it disturb her sleep. In sleep also, thought process continue. How can I plan and everything? And more symptoms about this patient is very impatient patient, and another is strong desire for company. So this is the gastric problem, very anticipate patient and hurried patient, impatient patient, and strong desire of company. So any suggestion about this case, any medicine, anyone can write in the chat box. I welcome if anybody write about.
Doctor, doctor, we are not allowed them to. After completing your talk only, they can.
But you can
it.
write in chat box also, no?
Yeah.
Yeah. You can,
Somebody
whatever.
written that argentum nitricum.
Pardon?
Argentum nitricum.
Argentum nitricum. Very good. Any other suggestion? You are right, sir. I prescribe Argentum nitricum, and with the 200 single dose, this patient improved a lot. On which basis I prescribe Argentum nitricum? Patient is very nervous and impulsive and hurried patient. Everything should be, pardon?
One written the phosphorus and another one next formica.
Netum phosphorus, okay.
Argentum nitricum, phosphorus and next formica.
Naxomica and phosphorus. Yeah. Okay, very good. But argentum nitricum I prescribed because of patient is anticipatory anxiety. What will happen? What will happen? And her hurried nature. And we know that this type of anticipation we can see in the argentum nitricum only, and desire for company. And impatient, very hurried patient. If patient has to reach any place, the time is morning 9 o'clock, but he will reach there before 1 or 2 hours because anxiety. If what happen if I don't, if get a proper vehicle or any problem, So he anticipate the problem, and because of that, he always in a hurry. So anticipatory anxiety is the main symptoms of the argentum nigricum. There is the appreciation and fear, stage fear, and nervous diarrhea. We know that it is good remedy for stage fear, exam fear, and because of this fear, it's produced the diarrhea. This is also anxiety. Fear of high places is another symptom of argentum nigricum. Craving for sweet, that's also another symptoms of argentum nigricum in a general way. So what are the gastric symptoms of flatulence causing distension and bursting of the abdomen? Distension of the abdomen. And because of that gas accumulate in the stomach, it's come upward or it passes from the downward with loud explosive. Because of this gas, there is a colic and distension of abdomen. Belching accompanied by most gastric element. There is a sour vomiting, bitter vomiting. So gas is there, distension is there with soreness and bitter vomiting. But main because of her nature, hurry and worried, very you can say that because of tension, because of any uh, thoughts in the mind and very hurried patient, that causes the problem. That's the argentum nigricum. Now I start second case. This is case is 25 years old unmarried female. She was in Mumbai. That's the one city in the Maharashtra, other state, far away from Bombay. Ahmedabad is 500 kilometers away from my place. So patient was in Mumbai, but she relocated in Ahmedabad 2 years ago in my city before 2 years. And she consulted me for hair problem, weakness, anemia, gas problem, acidity. And gas and acidity since 1 year. So these are the complaint for that this 25 years old female consulted me. So you can say these are the chief complaint. In her family, herself, her mother, and one elder sister. Her father expired 4 years ago because of the cancer. So now in her family, herself and her mother, and her sister study in another city. That's away 100 kilometers away from our town. So in weekend, she come to the house. Otherwise, now father expired, sister study somewhere else. So mother and our patient both are staying together. So patients move to Ahmedabad because there are many relatives in our city. So after father's death, they decided to relocate in Ahmedabad, another city where there are so many relatives are here. Now after father's death, and one more thing, her mother is suffering from muscular sclerosis. And you know that in muscular sclerosis, patient become paralyzed. Her lower limb totally paralyzed, even can't move her leg. Her mother's problem is muscular sclerosis. So after father death, all responsibilities of mothers, of household, and her job on this patient. Caregiver responsibility, and because of mother illness, she has to wake up 2 to 3 times at night. So not a proper sleep at the night because of the mother. She has to look after the household activity and job also. She is doing job as a graphic designer. So she has to look after workplace at household and main for her mother because she is totally paralyzed. And this mental and physical stretching causes the problem on our patient's life. And that's why hair falling, anemic condition, gastric problem. So any suggestion in this case? Any medicine come in the mind in this 35 years old female? Because of her father death, she has the responsibility. She has to look after her mother, also look after the home and office also, because earning is another issue. Any suggestions, sir? Okay. So I prescribe cocculus. What is the main symptoms of cocculus? There is a loss of sleep. But why loss of sleep? Because nursing of loved one. This is the main symptoms of cocculus. Loss of sleep. And why loss of sleep? Because of the loved one, nursing of the loved one. If any family members remain ill for a long time and anybody, one has to look after that relative. And because of that, night watching for quite prolonged time, and that affects on health. You can consider that night watching because of nursing of the loved one. As you know, the cocculus is very good remedy for motion sickness. I prescribe this remedy very frequently when there is a nausea and vomiting while traveling in rail or road journey. Cocculus you can indicate. So overstrain and mental and physical. This is the also one of the good symptoms of cocculus. Overstrain. Here, patient overstrain herself because of the nursing and because of the job and because of household. It's not her. He can do. She has not enough energy to continue this all work. Gastric symptoms of cocculus, that vomiting with profuse flow of saliva with headache, abdomen bloated with intentional gas seems full of sharp stool. And we can compare this cocculus with nux vomica for the night watching. In nux vomica also night watching. Patients work late night. But why this patient work for a late night? Because of his business. He is business oriented, very ambitious person. He wants to achieve his things by hook and crook. This is the nux vomica. And for that, he not sleep for whole night. And because of night watching, he needs coffee, alcohol, tea, and food also. So night watching in nux vomica for his ambitiousness, and night watching of cocculus because of nursing of the loved one. This is the main difference between two medicine, particularly for the night watching. And we know that nux vomica is very good remedy for GIT problem, but because of the irregularities of life and because of the smoking, alcohol, spicy food, these are the main causative factor of the nux vomica, particularly for GERD or gastric problem. And patient has to urge very frequent for passing stool 3 to 4 times a day, and passing stool give temporary relief to the this patient. That's the nux vomica. Now one more case, that very short case. Anybody can give answer of this case. Very simple case. That 23 years old college student consulted me for heartburn and gas problem. His digestion is weak and he is intelligent in very good in study, but lacking in confidence. Stage fright is also there. And in a look, very lean and thin person. And hungry, but at a time he can't eat much. Easy, quick satiety is the main symptoms of this patient. Feels hungry, but as soon as he start eating, in very few mouthfuls, he fulls. Any idea about this patient? Any suggestion? Very easy case.
Lycopodium. Lycopodium.
Very good. Very good. Quite right. I prescribed lycopodium to this patient, as we know that lycopodium patient is a very good remedy for gastric problem, and patient is mentally lean, very intelligent, but physically weak, and few mouthfuls, fulls up his stomach is another symptoms of lycopodium. So great weakness of digestion with much bloating, sore belching, vomit of the food and bile, gastroenteritis from the fright is another symptom, and I prescribe this remedy from its time modality. 4 to 8 p.m. is a time modality. Lycopodium patient desire for sweet, and as we know that lycopodium is right-sided medicine. And generally, I took mental symptoms that lycopodium patient is egoistic patient and dictatorial, love of power, but fear of alone. He can't stay alone at the night, and fear of public speaking also. And one more symptoms of lycopodium, that lycopodium patient is very dictatorial, very harsh to the his subordinate, but very kind or very, you can say, polite to his superior. This is the another symptoms of lycopodium. And in lycopodium children also, they are very, you can say, king type in the home, in protected environment. But when they go in the school or in playground with, you can say, other strong children, he become mild and no like king, but he become very mild person in that environment. So this is the indication of lycopodium in my practice. I use this understanding of this type. This is the fourth case. 36-year female consulted me for pimples, cough, and many problems, but he suffered from COVID before, and from the for COVID she hospitalized and took remdesivir injection also as a treatment of COVID. After COVID, she suffered from diabetes, developed diabetes, and even gastric problem also. Her other complaints are pimples before the menses, cough with expectoration, sleep late, but experience good sleep once, very late sleep, but once she slept, then very comfortable, good sleep. So gastric issue is difficulty in digesting even simple food, inability to lie down due to excessive gas. There is a breathing problem because of gas. Patient can't able to lie down very comfortably, and frequent passing of the gas through the mouth, and this all complaint worsen after the COVID recovery. Constipation or diarrhea during the menses, pimples also aggravated before the menses, cough problem, sleep problem, and sweating, profuse sweating, especially in the head part and in the palm and underarm. If we consider this patient mental symptoms, patient is very anxious, very fearful about her illness. From slight problem, ill health, she started thinking about some bigger disease like cancer. So extreme anxiety over the minor illness, not only for herself, also for her children also. She is very possessive about her daughter and overreacting need for family harmony. So very positive about daughter, anxiety about health of herself and her family members, and from the small illness of the children, she become very anxious and restless. So this is the case of GIT problem with this mental symptoms. Any suggestion of medicine?
Hard salt.
Arsenical, very good. But not arsenical. You are right, arsenical, because anxiety about health, fear of cancer, fear of death, and anxiety about family, we can consider arsal. But here, in this case, I prescribe first calcarea ars and later on kali ars. With kali ars, I got very good result because kali, we know that she has anxiety about family and kali related to family. That's why, and arsenic part is that fear and anxiety and restlessness. So I prescribe kali ars in this case. Now this is the last case, but very simple case. Anybody can give the answer of this case. Hoarseness of voice since 6 months and sore belching since 1 year. So patient approached me for hoarseness of voice and sore belching, gastric problem. This patient is very lively, very talkative, make friend very easily, and very caring and helpful. Whenever require any help from any person, he always ready to help them. And another things that he loves ice cream, he loves cold drink, and one more symptoms that whenever I have a burning in my stomach, burning in my chest, I take cold drinks or ice cream. It's give me very good relief from the cold drinks or ice cream. So for hoarseness and gastric problem, better by cold things and lively and very caring person. Any medicine, any suggestion in chat box? Very simple case. Which patients like cold drinks and ice cream? I prescribe phosphorus because crave cold in phosphorus. There is ice drink, desire for salty things, chocolates, hunger soon after eating, empty all gone sensation, water brush, sore taste in the mouth, sore belching, water thrown up. There is a vomiting from the stomach as soon as it get warms in the stomach. And I use phosphorus for the vomiting when there is a general anesthesia. Chloroform when used, and after chloroform effect, post-operative there is a vomiting, I use phosphorus very well. And we should understand, we should not prescribe on only gastric symptoms, but we should consider mental state, emotional state, physical general, and we select constitution medicine to cure our patient. This is the message after these cases. Now, directly I start, you can say therapeutic part of GERD. I prescribe phosphorus on the constitution. As you know, phosphorus patient is lean and thin, tube shoulder, mind very sympathetic, lively, talkative, mix easily. These are the mind of the phosphorus. Burning, this is the one of the medicine of trio of burning. Other burning remedy in trio that arsenic and sulfur. Arsenic burning better by warm, in phosphorus burning better by cold. This is the difference. It is hemorrhagic remedy, bright red hemorrhage. Respiratory symptoms are also important, and hoarseness of voice. So on this is the general idea about phosphorus. Now I start therapeutics part, other medicine where you can think in GERD that Robinia. Robinia is a remedy for hyperchlorhydria, means when there is the gastric acid level is higher than average, you can use this word hyperchlorhydria, and Robinia is a very specific remedy for this condition. So many people have a headache, migraine headache with the acid problem. They complain that my acid rush to the head and it causes headache. We can think of Robinia in this type of patient. And acidity of children. Robinia is a remedy with stool and sweating. There is a sour smelling stool, sour smelling from the patient body. We can think of Robinia. Incarcerated flatus, intensely acrid belching, acrid and greenish vomiting, nightly burning pain in the stomach. So these are the indication of Robinia. Belching of the sour taste, vomiting of sour taste sets in the teeth. That sour vomiting affects the patient teeth. And whatever this patient eat, Robinia patient, that turn in the acid is another indication of Robinia. Sulfuric acid, there is a burning in heartburn is very important with belching, and belching affects the patient teeth. Sour vomiting, hiccup, weakness is the very important. We all know that acid is known for a weakness. So in sulfuric acid, weakness that's out of proportion of the disease. This is the symptoms of sulfuric acid. And because of the weakness, there is a trembling sensation, internal trembling. And this patient is very hurried patient. Sulfuric acid patient like addendum nitricum, very hurried patient. What's the pain of sulfuric acid? That pain gradually increase and suddenly and stop. This is the in belladonna suddenly increase, suddenly down. That belladonna pain. But what sulfuric acid pain? It gradually increase and suddenly stop. It is good remedy for purpura hemorrhagica, and there is the black or blue spot after the injury, after the trauma. We can prescribe this medicine after the arnica. So it is good remedy for injury also. So gangrene type of injury following the mechanical injury. Gangrene after the mechanical injury, you can think of sulfuric acid. It is good remedy for intraocular hemorrhage when there is an eye injury or any problem where hemorrhage collect in the eye. We can think of sulfuric acid along with arnica and ruta. And many times I prescribe sulfuric acid for the alcohol who wants to leave the habit of alcohol. I prescribe sulfuric acid mother tincture, 1 part of sulfuric acid and 3 part of alcohol. Dr. Herring says if we continue this type of sulfuric acid dose for 4 weeks or more, patient can leave his habit of alcohol. Iris versicolor. I use this remedy very frequently when there is a head complaint along associated with gastric problem. Whole alimentary canal, that's the burning. And in phosphorus, burning better by cold drink. Here in arsenic, iris versicolor, burning not better by cold drinks. So this is the difference between phosphorus and iris versicolor. Sour vomiting, bile, profuse flow of saliva. And when there is a migraine headache, because of acidity, you can think of iris versicolor. Carbovage, we know this remedy very well when there is a gas. And because of the gas, there is a distension of abdomen. Simple food not digest. It simple food. If patient says, sir, I never eat outside, never eat any rich food, but my simple food also causes lots of gas. That time you can think of carbovage. So belching, heaviness of the abdomen, fullness and sleepiness. And because of distension of abdomen, there is the asthma-like symptoms. Patient can't able to breathe also because of too much accumulation of the gas. And upper part of the stomach is distended because of the gas, and patient feels better after the passing gas. Because of loss of vital fluid, vitality of carbohydrate patient is down and body become blue and icy cold. And patient want fresh air, fan, and must wants to window and door open. So craving for air, you can compare lake acid. Lake acid patient also wants a fan. Carbohydrate patient also fair, wants fair, and its body become cold. One more remedy as a therapeutic, that natrum we can, this is the biochemic medicine, and we can use when there is a excessive of acidity, sour belching, and sour vomiting. Taste in the mouth also sour. So sourness is very prominent symptoms of the natrum and there is the coating of the yellow creamy on the tongue, posterior part of the tongue, and root of the mouth. This is the indication of the natrum One more remedy, that natrum carb. So natrum group, natrum more, natrum carb, natrum phos, natrum sulf. As we know, natrum sulf is a liver remedy. So this all remedies affects the GIT problem. So in natrum carb also, digestion is weak, and from the slightest error of the diet, it causes the problem. Gastric pain better by eating. This is one of the PQRS. You can say that if there is a gastric pain because of the ulcer or anything, and patient eats something, he feels better. Hungry at the 5 a.m. Indigestion, gas and bloating, accumulation of the gas, and because of that, painful movements of flutters in the stomach. So this is the natrum carb. Now, what is the general indication of the natrum carb? So patient worse from the vegetable and starchy food. Even milk not digest. Milk causes the diarrhea in natrum carb. We know that natrum carb is good remedy for headache, particularly exposure of the sun. So sun aggravation is, we can see in the natrum carb, music aggravation, and when there is electrical changes in the atmosphere because of the lightning or thunderstorm, there are effects on the patient. Another remedy that we know, that phosphorus. Phosphorus is a fear of lighting, but because of electrical changes, patient affects. That's the natrum carb. And one more symptom, that's when patient overheated and taking cold drinks, that also affect that natrum carb. I use magnesium carb. Magnesium group 2 remedies, magnesium carb and magnesium more. When patient taking magnesium carb to sweeten the stomach, and because of this, if complaint arise, if patient taking regularly this magnesium carb in the allopathic point of view, and this causes the problem, we can think of magnesium carb. From magnesium carb patient's body, there is a sour discharge, especially in the children. So small, sour smelling discharges or sour smelling smell from the patient's body. You can think of magnesium carb. Other remedy, that rheum. We know that rheum is good remedy for children, particularly for dentition problem. So Robinia, rheum, and Mecca is a good remedy for sour smell from the body, sour discharge. So sour vomiting, bitter in the, and orphan feeling. We know that magnesium group is known for orphan feeling, and this patient is very sensitive to even struggling from noise or touch, and milk can't digest magnesium carb patient. After taking milk, there is the diarrhea and sore throat. This is one of the general symptoms. before periods, menses, patient complain of the sore throat complaint. You can think of magnesium count and marasmus child. Though in spite of taking good food, marasmus we can see in the children, that's also carb. One more remedy, that's magnesium more. Magnesium more is a very liver remedy. It's good remedy for enlarged liver, and because of liver problem, there is the distension of abdomen, belching like rotten eggs, like onion, hiccup is there after the dinner, and this patient also can't able to digest. And I use this remedy for the constipation, particularly constipation in the children. Magnesium bore is a remedy where constipation of infant, naughty, stool like sheepdog is the indication. I use other remedy, that plumbum, opium, podophyllum, nux vomica in children's constipation. But one of the good remedy, that magnesium bore. There are few remedies of the we can use. Pulsatilla, we know the nature of pulsatilla patient, changeability is there, and fat food, cake, pastry, and fatty food causes the problem in pulsatilla. China, we know that distension of abdomen, there is the accumulation of the gas in a patient, but can't able to pass this gas, and that causes the problem. We can think of China, arsenical, it is burning remedy. Petroleum is another remedy. Ferrum metallicum is also another remedy. Sulfur, morning diarrhea, all gone sensation, desire for a sweet. You can say that philosophical type patient, silicea, nitric acid, calgarica. These are the known remedy we can use in the GERD or gastric problem. So here I end my lecture, where I describe about GERD, diagnosis point of view, signs, symptoms of point of view. Also, I talk about anatomy and how its GERD causes a problem. And repertory part also I covered. And materia medica, I tried to give idea through the cases and as a therapeutic also. I hope you like this talk. Thank you very much for this opportunity. Thank you very much, sir.